Malaria is caused by a protozoa, which is under the class of Plasmodium. The most common type of Plasmodium is Plasmodium falciparum. This is most common in sub-Saharan Africa and causes the most severe cases of malaria. The life cycle of malaria in a human is as it enters through a mosquito bite as a sporozoite. It enters the human's bloodstream, and as it travels through the bloodstream, it aims to reach the liver, and here is still a sporozoite. Then the malaria develops in the liver into a merozoite. During this time, the malaria is unsymptomatic. Then it re-enters the bloodstream from the liver and aims to infect red blood cells. It is still a merozoite at this time. The merozoites then multiply inside the red blood cells and break the red blood cells down. This is the goal of malaria. After the malaria breaks down the red blood cells, it is able to continue on its path and infect more red blood cells and destroy them. Transmission. Malaria is transmitted via vectors. In this specific case, it is transmitted via Anopheles mosquitoes, female ones. Vectors are carriers and transmitters of a disease. Malaria is also zoonotic, which means it cycles between humans and mosquitoes. It can also be transmitted to mosquitoes through other animals. A mosquito can be infected by a human too, only by infected humans. If a human is infected with malaria and is bitten by a mosquito, the mosquito can contract malaria and bring it to other humans. Malaria is a blood disease. This means that its transmission and infection have all to do with blood. It is mosquito bites a human, gets their blood, which is infected, and transmits it to another human through their blood. Pathogen information. Most of the symptoms are caused by issues with the blood from the malaria. These symptoms include fever, chills, headache, seizures, confusion, fatigue, difficulty breathing, convulsions, dark or bloody urine, jaundice, anemia, and unusual bleeding. Because the malaria breaks down and destroys red blood cells, anemia is often a result of malaria. The incubation period is 2 to 4 weeks. In this time, the disease travels through the bloodstream, enters the liver, develops in the liver, and goes back to the red blood cells. The African region is the region most heavily affected by malaria. In 2023, it held 94% of cases and 95% of deaths caused by malaria. In 2023, there were 263 million cases of malaria in this region. There were also 597,000 cases that resulted in death. Testing. There are many different ways to test for malaria. The first one is malaria blood smears. In this test, the individual is looking for the presence of the malaria parasite, specifically a trophozoite. The next one is a complete blood count. This is done again because of anemia. Anemia is when the red blood cells in a human body are much lower than they should be. A complete blood count counts the number of red blood cells in the human body. Depending on what stage the malaria is in, this test can be very useful. Another test which is useful is rapid diagnostic testing. Much like COVID-19, you gather a sample, input it into the tester, as well as a buffer, and wait for a result of positive or negative. These tests can be reliable, but their accuracy is sometimes debated. Treatment. There are many different forms of treatment, but it is very dependent on the person and the type of malaria that they have. Again, there are many different types of Plasmodium, and not every single treatment will work for every single Plasmodium or person. The malaria might be resistant to anti-malarial medications. If the person is pregnant, then they may not want to take these more dangerous medications. In addition, the weight and age of an individual comes into play. A person must be tested for specifics of their malaria to receive proper treatment. The most common medications include chloroquine, primaquine, and artemisinin-based combination therapy medicine. They each perform differently. For example, chloroquine works to stop or prevent the disease from producing hemoglobin. Hemoglobin allows the parasite to reproduce and develop. But again, chloroquine is only effective if the malaria parasite, the specific one, is chloroquine sensitive. Because of this, chloroquine is most commonly used against Plasmodium ovale or Plasmodium vivax. In contrast, primaquine focuses mostly on the malaria that is in the liver stage. It aims to destroy the parasites in the liver stage. Again, primaquine is most sensitive to malaria that is Plasmodium vivax or Plasmodium ovale. In addition, primaquine helps to prevent or stop a relapse in malaria. Lastly, artemisinin-based combination therapy medicines aim to kill and destroy the Plasmodium which is in the blood stage. Artemisinin-based combination therapy medicines are usually used in the cases where the malaria is chloroquine resistant. In these cases, it is seen to be very effective. While these are not vaccines, there is a vaccine that is administered to prevent malaria. Both the RTS-AS01 vaccine and the R21 Matrix M vaccine are used in places where malaria is very prevalent. However, these vaccines are not given to adults. They are given to children, specifically children that are in the areas that are moderate to high in transmission. Like other vaccines, the RTSS and R21, once administered, are used to train the body's immune system to recognize and help fight off the malaria parasite. New study. In this study I found they researched the effectiveness of antibodies to antigens. In children under 5 years old, they found that certain antibodies to antigens were associated with a decreased risk of developing clinical malaria. Specifically, the antibodies IgG/IG1 to GLURP-R2. It was also found that other antibodies to antigens are associated with an increased risk of developing clinical malaria, specifically IgG3 to CSP. In children between 5 and 14, multiple antibodies to antigens were associated with an increased risk of developing clinical malaria, while none were found for decreasing risk. As for 15 and older, the case is the same. The findings pointed to the conclusion that the older you get, the antibodies to antigens that prevent developing clinical malaria are severely decreased.